how to distinguish the different cases.
Dottoressa, 20 minuti.
Grazie, spero io di essere sufficiente.
Thank you very much. I hope I will be clear enough. I'd like to thank Dr. Valentini, who has given us the opportunity to participate in this meeting, in this conference after our collaboration, because many of the patients she has seen are shared with our center because of the lot that should be said has already been said very clearly by the previous speakers, by Professor Saletti, by Professor Bussone and the other speakers. I was asked to focus on the classification of a headache. This is perhaps a rather boring subject, but this may be helpful to remember some fundamental elements of these clinical pictures to avoid misdiagnosis and wrong treatment. The headache is a common, very widespread problem. Studies indicate a worrisome prevalence of this symptom. And also, this is a condition which is very invalidating, creating a lot of discomfort, both in young patients and in their families, of course. This is the reason why our clinical activity has been supported with laboratory for these young patients only to investigate this specific symptom that may or may not be associated with other diseases. The natural history can differ a lot, and the epidemiological classifications are many and not very helpful, also because in adolescents and in young patients in general, and here there are specialists who know much more than me, all forms of headaches, so from migraine to tension headaches and so on, can be blurred and can be mixed, or you can have different forms at the same time, and so it is very hard to make epidemiological studies that are reliable. Before 1988, there was no classification whatsoever, and so our classifications were very rough and just based on the distinction between primary and secondary headaches. Since then, a group of clinicians and researchers internationally have developed an IHS classification that has helped us in making more accurate diagnosis, especially in young patients. In 2004, this classification was reviewed. Here you see the main primary headaches, so migraine without aura, with more common, and migraine with aura, and then tension type headache and cluster headaches, very rare in young patients. These criteria were also applied to young patients. They were reviewed partially, considering some items. First of all, the duration of pain, and pain can be bilateral, like in migraine, and also the sleep too. can be often effective to relieve the symptoms. As to the other classification criteria that were mentioned for adults are applied also to young patients. And also the tension type headache. Headaches can be found quite frequently in these young patients, and especially a specific type of headache, especially for young patients, is this chronic daily headache. This is an headache that causes a lot of discomfort in these patients and in their families. The pain is continuous since the onset of symptoms, but pain is not the only symptom. It is often associated with fatigue, and often these forms cause very severe discomfort, and therefore these patients need to be treated very accurately, because these constant symptoms, especially if there is an hereditary headache, can lead to analgesic overuse and a potential worsening of the disease. As to the headache attributed to Chiari malformation, our had already said that these symptoms can overlap often. Cough is often a telltale sign of Chiari malformation, but fortunately or unfortunately, we have neuroimaging that can help us to make a diagnosis, to diagnose Chiari malformation in the presence of headache. And this is probably the reason why Dr. Valentini has invited us to discuss this subject, because often patients that are referred to her with diagnosis of Chiari ready for surgery, they are referred to us by Dr. Valentini because the clinical picture creates some problems also from the emotional standpoint, because this can result into misleading expectations on the part of the patient. And so here we as you have seen already before, I've listed here some items that can help us make the diagnosis of primary headache or Chiari headache. Certainly, considering the clinical history of the patient, the family history of the patient is important. However, a lot of attention needs to be devoted to the overall clinical picture of the patient as well as of the family in order to understand, therefore, also the degree of disability referred by the patient himself or herself. So all these items need to be investigated carefully to come up with a reliable diagnosis without neglecting the major points being history, headache characteristics, physical examination, and tests. And also neuroimaging can play a key role in that it offers us a solution to understand exactly the clinical picture. So after ruling out these organic problems, we have to remember that a careful look must be given to dietary habits, sleep habits,
presa di coscienza sulla storia dei farmaci,
medication history, and also family history.
Tutto questo lavoro diagnostico è
So this diagnostic activity must rely on understanding the best strategy to come up with a reliable diagnosis first, and then with the treatment to be administered to this patient. Silverstein reminds us that reassuring the family about the condition of the patients, and also adjusting the lifestyle and the identification and elimination of headache triggers can play a key role in relieving this headache even by 30%. And therefore it is very important to understand the clinical picture and suggest the right treatment to the patient so as to reassure both the patient and the family. And in case of Chiari malformation, we have to wait and see to understand whether there can be other conditions that might be faced and solved with a different approach.
Bravissima anche per essere rimasta nei tempi.